Hey guys, John Adamson, the Rehab and Documentation Guru. As usual, enjoying coffee. This is a vanilla iced coffee at McDonald's. Pretty good. It's a little bit cheaper than going to Dunkin' Donuts, which is my favorite, but it's still pretty good. So I wanted to talk today about needy patients, but also about doctor's referrals. I had 2 case openings today that it probably could have taken me at least a half hour less in the home on both of them. Incredibly needy patients. One just probably needs to be inpatient. He's probably going to be an APS referral. We're getting social work involved. Just a mess. And I don't know what they expect physical therapy to do, basically. We're going to try. I mean, every patient deserves a try, right? And by the way, avoid documenting the word trial of therapy. It means nothing. You make goals you think you can hit. You might be a little optimistic with some patients, and if they don't make them, you discharge. You don't talk about trials. So I'm not doing trials of therapy. I'm doing therapy. My little rant on that. Also, if you say a trial, you're basically indicating, I don't think you should pay for this. Probably not going to be effective. Probably not a good word. Words have meaning, and sometimes they carry some weight if people are paying attention to them. So anyway, I'm going to give it a try and see if he makes any progress within a couple weeks. But if he doesn't, we're going to have to cut him loose. But just all over the place. And the caregiver obviously needs help, but he doesn't have it. And so he's bringing up stuff about himself during the case opening. I go to see my second patient. Chronic pain. When did this originate? Oh, 1981. What do you want us to do? Get rid of the pain. Okay. Now, there was another issue that was more recent that we could address, but one of the big goals was getting rid of chronic pain that's been around since 1981. She has a lot of issues going on that we can address posturally that I think will help with management, so we're going to give that a try. But her husband, I had to talk over him at times because he would start bringing up all sorts of stuff about himself. And it was one of those situations where I had to interject to the patient. Like I'm there first starting just signing paperwork. Like, I'm from this home health agency, and here are, this is what this form means, and need you to sign it to start care. And she's just chattering away about health history. And I said to her several times, very gently, very kindly, ma'am, if you tell me this stuff now, I'm going to have to ask you to repeat it later on, because I won't remember it when I get to the point at which I can ask you about your specifics. And finally, after about the 5th time of saying that, she did a little bit better. So anyway, do you ever have those days when you're dealing with just like incredibly needy patients and caregivers? But then I want to talk about doctor's orders, because this is another situation where I really felt like the doctor ordered incorrectly, in part. So the doctor told the patient on the second case, chronic pain, because she's very independent, walking around, that he wanted her to get home health because she didn't have her own car and couldn't drive herself, even though they can get out occasionally with a friend. And I had to explain to her that's not a home health criteria. Coverage is not based on whether you have a ride available or not. It's just, do you have the capability of? But I know I can make a case for her on 2 specific issues, and that is, number one, I can make the case related to her pain, which is like way high, and it is taxing for her. So pain will definitely be one, and of course COVID right now, Medicare relaxed some of the home care requirements, so COVID helps in that regard. She also has a managed Medicare. She's got some pre-authorized visits, so we might be able to take advantage of that some. but not going to be a long term. But I thought I would just bring this topic up because I am getting so frustrated lately with doctor's orders, most particularly because they have no clue what therapy is for. And I'm going to have to send notes to these doctors, and I'm going to let them know specifically what I can do, what I can't. And also, in these two cases, clearly some issues being missed on these patients that a medical practitioner should have picked up on. And here I am with my lowly bachelor's degree, seeing stuff going on medically that's not being addressed, and that's just irritating. So I'm making a video about it. And I'm moaning and griping to you who probably have experienced some of the same issues. So, anyway, that's my video for the day. That's it. Just talking about needy patients and doctors that need to probably get some education on the role of rehab professionals. Anyway, I hope you're having a great day. Take care and God bless.